good morning. So great to be with all of you here today. I really want to thank you so much, Dr. Willie, for the introduction, and Lakeisha for your powerful advocacy. I'm grateful to Bloomberg Philanthropies, Bloomberg American Health Initiative, and Johns Hopkins for hosting this impactful event today and inviting me to share some remarks with all of you. Thanks also to all of you attending the summit, both in person and online, for your commitment, your dedication to really looking at all these critical health issues and seeing the interconnection between them so that we can all advance in a more holistic manner ways to address all of these important issues. Addressing and preventing domestic violence, dating violence, sexual assault and stalking, and other forms of gender-based violence is an important public safety and public health issue. The costs and the impact associated with the long-lasting effects of gender-based violence place such a high burden on survivors, on children who witness and are impacted by violence, and on communities as a whole. And so we know this requires a multi-level approach at the individual, relational, community, and society level. The Office on Violence Against Women at DOJ has a responsibility of overseeing the implementation of the Violence Against Women Act, also known as VAWA, and fostering a coordinated community response, what we call a CCR, has been a hallmark of VAWA. And this approach really reflects the theme of this summit, the theme being connections. While it might be easier to do our work in silos, we realize that the lives of survivors do not exist in silos. They need us all to be making these connections, to do this work in a more comprehensive way, and really be able to provide a more holistic approach. And this coordinated community response recognizes the important role of many different sectors at the local level, whether it's court systems, law enforcement, victim advocates, but also many others providing supportive services, not only to DV shelters, but transitional housing and legal assistance, as well as the critical role of the health sector, child welfare, educational institutions, and many other sectors. But at the same time that we talk about a coordinated community response, sometimes it turns into a coordinated systems response. What does it mean to put the word community back into that? What does it mean to recognize the strengths, the resilience, the courage, the vision, the leadership of survivors, of communities, to make sure they're at the table too? Amazing advocates like Lakeisha and those who have really turned the pain into purpose of seeing how we as a nation go further in addressing these critical issues and preventing and addressing GBV and broadening the pathways to safety, to support, and to healing. Last year, President Biden signed into law the bipartisan VAWA Reauthorization Act of 2022. That's the fifth iteration of VAWA since it was first enacted in 1994, when then Senator Biden championed VAWA, based on and working with survivors and advocates who really brought this issue to the forefront. And so next year it'll be 30 years since the original passage of VAWA. And each iteration of VAWA, every time it's up for reauthorization, has been an opportunity to say what's working well that we need to scale up, where are there gaps and barriers and emerging issues that we need to address, and how do we continue to strengthen the survivor-centered and trauma-informed approach. So this requires centering the voices and lived experience of survivors to ensure that all survivors, including those from historically marginalized and underserved communities, have the resources, the tools, and multiple pathways to safety, healing, and justice, and doing it from a strengths-based approach when working with different communities. Just recently, we had an opportunity to gather in Oklahoma for our tribal consultation, government-to-government consultation with 574 federally recognized tribes, doing so from a position of sovereignty and strength and hearing from them what's working well, how can we be better partners, how do we provide a range of options for safety and justice. And similarly, I was in LA just 2 weeks ago meeting with culturally specific community-based organizations, with prisoner reentry programs, with community violence intervention initiatives, all these different ways that we need to continue to integrate this work. So VAWA's scope has continually expanded, not only to maintain the essential programs, but really to be able to support these kinds of services that can address a myriad of challenges and do more to go upstream and more on prevention as well. That includes also addressing huge issues of economic stability, of housing that we know are so crucial. And I know the Bloomberg Initiative has really been doing important work in researching and lifting up many of these intersections. New protections in the most recent VAWA also addressed other emerging issues. So for example, while advances in technology have really helped strengthen connections, as we all know, and it's great that it allows us to do this in a hybrid way and bring in people who aren't in the room, we also know that technology-facilitated gender-based violence is growing exponentially, and that we need to do more, recognizing that there are those who can weaponize these tools for harm, and in fact are doing so. So this most recent VAWA, for the first time, has a definition of technological abuse. We're funding new resources to have a national resource center on cyber crimes against individuals, including the non-consensual distribution of intimate images and also cyber stalking. And really, how are we better training law enforcement, victim service providers, educators, and others to really address these critical issues that are disproportionately impacting women, girls, LGBTQ individuals, and others. Also, this VAWA, for the first time, has funding to address restorative practices. So what does that mean to make sure that we are creating multiple options for safety and for justice and letting survivors define the kinds of resources and support they need? For the 2023 fiscal year, VAWA appropriations reached $700 million, following an unprecedented increase of over 30% during the Biden-Harris administration to really center this. And we gave out more than 800 grants, a lot of them also national training and TA, and important research and evaluation dollars as well. And yet, undoubtedly, we have much further to go. So similar to the coordinated community response we're trying to support at the local level, we realize we need to improve connections at the federal level and really make sure we're fostering a whole of government approach to addressing this. So we are excited that just this past May, the White House launched the first ever national plan to end gender-based violence, Strategies for Action. And more than 70 countries around the world have national plans to end GBV, but this is the first time at the US level that we brought together more than 15 federal agencies based on the input of stakeholders, survivors, community leaders, all of you on the front lines who are so important. And these 7 pillars in the plan really help set up a roadmap and a framework for us to continue going forward. And so if you haven't seen it, I commend it to you, and we look forward to the ways that that can help us all address both as a public safety and public health issue. So while we've come a long way, we know we have much further to go. And while the federal government has an important role to play, we realize that we need to make sure all of us at the local and state government level, at the tribal government level, community-based organizations, faith-based, philanthropy, educational institutions like Hopkins and others, that it takes even the commitment of each of us individually to really be a part of changing these social norms and making sure that we as a society can create an environment where everyone can thrive free from violence. We know at the end of the day, it's not just about improving social services, it's about working for social transformation. And so I want to thank you. I want to thank you for this opportunity to provide some remarks and speak with you. I want to thank you for all the ways that each of you play a critical role in moving forward, and I look forward to ongoing opportunities for collaboration so we can share and advance these goals together. Thank you.